Hi, I'm Dr. Mull.
I'm Dr. Crisp.
And thanks again for joining us for another Research Friday. If you would like to reference that article, you can check the link below.
Yep.
And today we're going to be talking not so much about a specific article, but more so a concept called Haglund's deformity.
Haglund's.
Yep, Haglund's.
Is that like a witch? What is
Depends
that?
on where you're from. Might be Haglund's,
Hagelands.
Haglund's, or I don't know how to pronounce it.
I don't know. We can make it up.
Yeah.
All right. So
I just know it's a deformity, and thankfully I remember it's a deformity in the back of the heel.
yeah, it's a big old knot-looking thing. It's like sometimes you see it and you're like, do you have like a mass on the back of your foot?
You
What
look
is
like
that?
you have Osgood slaughters on the back of your heel.
Yeah, it's a big old bump.
Yeah.
Absolutely. So what is that?
Yeah, it's actually a kind of a combination of soft tissue development. That's really what it is. So the soft tissue starts to develop, and you start getting bony abnormalities to grow from the stress that's applied to it in the back of the heel. You will get quite a bit of inflammation in the area, and sometimes it's not your typical red swelling inflammation. It's kind of like an old ankle sprain where there's this fluid that sits around it.
And then you got those bursa in back there between the Achilles and the soleus and the plantaris, and you can, I bet you upset that a lot too.
Yeah, you can actually get Haglund's deformity with the bursitis associated with it.
That does not sound
And some of them will even come down with Achilles tendinopathy with it.
That does not sound fun.
They're difficult to get to go away.
They're very difficult to go away.
In fact, a lot of them don't go away.
No.
There's surgical procedures out there where they go in and they take care of that and has some beneficial component to it. But there are conservative ways you can manage this. These individuals typically come in and they talk about, oh man, my shoes are bothering me, and it's because they've got that extra bony growth on the back of the heel and it's rubbing in the shoe. And so when you look at managing Haglund's deformity, from my own personal experience with these, I don't find full resolution with the manual therapy or rehab.
Nope, I don't either.
I find patients get to a point of 60, 70% better, and then it just kind of keeps coming back depending upon how much they walk or what types of boots or shoes they're in. But it never seems to go away. And so actually reading through an article years ago, I came across a great strapping maneuver.
Which is super effective.
You've tried it out.
I've tried it out. We've tried it out on some athletes at some big competitions, and they loved it.
Yeah, and provides enough temporary relief that they're able to perform their activities or daily routine with minimal discomfort.
I say, can we show it? Yeah,
we can actually walk through this one. And the nice thing is, it's super ineffective. I mean, super inexpensive. It's effective, not ineffective. It's effective. It's inexpensive.
And that's the main thing.
They don't have to go buy some fancy machine or modality. It's, hey, I can get some tape, learn how to tape it and tape it up, and it causes quite a bit of relief.
And you can do it yourself, which is the greatest thing ever. So, all right.
One of the interesting things, they do talk about conservative care. Yes, you can assess their footwear. Most of us don't have the time or maybe the skill set to evaluate somebody's footwear. So I always like to team up with somebody.
Oh, absolutely.
The downside to teaming up with a great group is sometimes they don't know what Haglund's is. And so it's oftentimes hard to do that. And so just helping them understand they can get in a cushioned shoe for the back of the heel helps out. Not so much those hard work boots. That's typically what aggravates the bursa.
Yeah, big time.
And then there's some great medical modalities out there, injections now with ultrasound guided injections that have proven noteworthy. And so it's really a co-management process,
very much so,
rather than a solo management process.
Absolutely.
That's what I find to be the best. Team up, co-manage, tape it, and good recovery.
And let them enjoy their life. Absolutely. So I'm excited to see the tape job.
So we'll actually walk through the tape job for Haglund's. It's pretty effective in decreasing the overload or the tension that's on the back of the heel.
Perfect.
So let's walk through that.
Let's do it.
All right. So to start this tape job, you'll take your athletic tape, and typically with the Haglund's, it's retrocalcaneal. I'm going to start just a little bit above that, and we're going to start our initial tape. You don't want it to come on the front side of the foot. So for purposes of this, I've already cut a few of them. I'm going to support that again with a little bit of a load as you put it on. And that's about where we want to start. We don't want to get too high in the Achilles. You start irritating the Achilles tendon. And all we're going to do is we are going to eventually basket weave this tape into position. So after every strip, you secure it down the opposite way and just work your way up, starting from the heel and up. We're only going to go mid-foot. Like I said, we're not going to tape that on the front side of the foot. And we're just going to support and anchor those down as we go along. As we strap up through both sides, just setting down that little weave, and we're going to come to the back of the heel and make sure that stays on. And then I'm going to support this piece as I come up over the heel. Now what you can do from this point is you can take a longer piece of tape and you can strap now the ankle to secure the tape stays in place. What I like to do is take a little bit more flexible tape, whether it's kinesiology tape, etc., and I can do a wrap around the foot to make sure that this tape stays on. The important piece, once again, keep the front of the foot open and only basket weave the most distal part and back side of that heel, not coming up in front. This is going to take the tension off the Achilles as you apply a pretty good amount of pressure, and it's going to allow this patient to have full range of motion all the way through, but they're not going to get the constant pulling as they come up through the tendon.
Well, Dr. Mall, that tape job was super simple.
Very, very simple.
Very simple.
The most difficult part about it is just getting used to athletic tape again.
Yeah.
The tearing part.
Yeah,
that's
the
about
tearing
the most
part.
uncomfortable
Once
part.
you get used to it, you're good.
Yeah, but otherwise it's easy to put on. Patients can go buy this stuff for cheap, do it themselves really, and at least have substantial relief to perform their daily routines.
I think it's great.
So a simple way to manage Haglund's deformity in your office, but the most important piece is helping a patient manage it outside your office.
And that's the most important thing, letting them realize they can do it themselves.
So, another Research Friday with some great clinical pieces that help us manage patients' injuries a little bit more. I'm Dr. Mall.
I'm Dr. Crisp.
And we'll see you next Friday.
See you next Friday.